So you may have seen yesterday that the U.S. Preventative Medicine Task Force has changed their recommendation for mammograms from age 50 to age 40. Now you probably also know that there's a lot of weird different recommendations from various groups, like the American Cancer Society recommends starting mammograms at 45, the American College of Radiology, the Society of Breast Imaging, and also the Society of Breast Surgeons all recommend starting at 40. So why are there different recommendations, and what should you do as a patient? So we know that mammograms save lives. They find breast cancers before they're clinically apparent, before you as a patient and I as a clinician can find them on exam. The problem with doing them too early is that potentially you're going to be biopsying things that don't turn out to be cancers and causing anxiety and fuss for those patients. You also may be finding and treating breast cancers that are not a really aggressive cancer, and you really didn't need to find it that early. The problem is that from recent evidence, we're finding that breast cancer rates in younger women are increasing. And we also found that the disparity in outcomes with Black and white women has gotten worse. And so that's why the U.S. Preventative Medicine Task Force has changed their recommendation. I think it's important to note, as a surgeon who cares for breast cancer patients, that mortality is not the only thing that we should look at. When you catch breast cancers earlier, the treatment options to women are different. They may be less likely to require chemo or radiation. They may be less likely to require a mastectomy and be able to have breast-conserving therapy. So finding breast cancer early has lots of benefits that may not translate into improved survival rates, but they translate into better options for the woman. So it's unclear at this point why breast cancer rates in the 40 to 50-year-old population have been increasing. Breast cancer mortality has been decreasing with time, but it's still the second greatest cancer-related killer of women in the United States. One of the important reasons why the task force stated they made this change is to hopefully improve breast cancer outcomes for Black women. Black women in the United States have 40% worse mortality with breast cancer when compared to white women. And tumors in Black women that are diagnosed between the ages of 40 and 50 tend to be more aggressive, and swift treatment is key to survival. So every woman over the age of 25 should discuss with their doctor when is the right time to start breast cancer screening. Although for the average woman, the age of 40 is the recommendation for most of us. If you have a family history of breast cancer, that may be sooner. So it's really important to know when you should start screening so that we can catch tumors early. And again, it's not always just improving the mortality rates, it's improving your life and allowing you to have better options for treatments that are less morbid.